Hi, and a warm welcome to episode 6 of Verbl Physio. I'm Dr. Sudarshan, and I have my 4 questions today, which are essentially more to do with physiotherapy injuries and fitness related issues. So, my first question is from a fitness enthusiast who wants to know, I have been following a specific regime for the last 3 years, but I don't see much of a result now. What could be the reason? The second question is from a mother who wants to know, I have a 4-year-old kid and he's been suffering from vitamin D deficiency and his walk has been hampered because of that. I have been advised physiotherapy, but do you think it will work? The third question is from a patient who's suffering severe back pain and has been advised surgery by his orthopedician. His question is, can I evade this surgery? Okay, and the last question is from a person who's witnessing a lot of cracking while moving his neck, and his question is this really good, and how different it is from doing it from a professional, and what are the benefits? So before we put on to our answering of our questions, I would like to welcome you all and thank you so much for watching Verbl Physio. This is clearly evident that you guys are loving this show, because we have our viewership which has been increasing consistently, and we are getting more and more questions from you all. And in case you are someone who's been watching this for the first time, whether you're a fitness enthusiast or who's struggling from an injury, a cyclist or a runner, I'm happy to help you here and answer all your questions. Here is the link to my question where I can answer your question. It is drsudarshan.co/question. So put in your details in this particular question and I'll be more than happy to answer your question in the upcoming episode. Till then, let's start off with our first question for the day. So our first question is from Yusuf Khan, who wants to know, I get a lot of sound while moving my neck these days. Is this normal, and how different is this from getting a back cracked from a professional, and how does it really help? Okay, thank you so much Yusuf Khan for writing in. And moving your neck normally once in a day, if you get these cracking sounds when you move it in end range of motion, is absolutely fine. That's absolutely okay. But let's say this has been more frequent and this is only in one specific movement, then it can be a little problematic, because it only means that your tissues are rubbing against your overall other structures. Okay, making of the sound is nothing but the gas bubbles which comes out from your synovial fluid of your specific joint when you do this particular movement. But I would not expect you to do this on a very consistent basis or keep doing it throughout the day, because that is something which is not really advisable. Now, what is the difference between getting it cracked from a professional? Well, when you do this particular movement, it's only in a certain form, it's only for a certain group of areas. Okay, but when it is done by a professional, they ensure that it is your whole neck and your overall spine is covered. So whether it is your upper cervical, whether it is your mid cervical or your lower cervical, or even your thoracic spine or the lumbar spine, when you have to crack it, you ensure that you're cracking the complete spine. Whereas whenever you do this movement on an individual basis, you're only doing it for any end range of motion where you feel that there is a little bit of stiffness, and you just try to evade that stiffness by cracking the joint. So this is the difference between doing it professionally. And what is the solution, or rather what are the benefits when you crack your neck or back? Well, it is scientifically shown that it has improved the range of motion. It has helped in certain areas where you tend to get a catch. It could be like a morning catch which you get sometimes when you just get up and you see that your neck is completely stiff, or probably a back is just holding up somewhere. So this definitely helps in this kind of problems. It is also shown to activate your sympathetic system, because of which there is a release of endorphins, which are like painkillers for your body, and it also helps you to in fact release these endorphins and reduce that pain effect. So these are some of the positive effects of cracking up your back when it is done by a professional. I hope I have answered your question, Yusuf Khan. Moving on to this next question. So the next question is from Rakesh Jadhav. and he wants to know, he's from Thane, and he wants to know, I've been advised surgery for my back in the next 6 months, but before that the surgeon wants me to try some exercises for core activation and understand to what extent can I really recover. Is it possible for me to evade the surgery? Well, thank you so much for writing in, Rakesh. Whether it is possible for you to evade the surgery is a decision between the orthopedician or the surgeon and you. But talking about the core activation that your surgeon has asked you to do, let me help you understand how core activation will really play a very crucial role when it comes to your rehab process and how important it is. So, whenever we talk about back injuries, we always understand that it is the spine and it is the nerves that probably get impinged or pressed at some point of time, which causes that pain to radiate down. And all the surgeon is doing is basically, deactivating that whole process by releasing that impingement and reducing the pain. But before these things are affected, what really affects is your core. It's probably because you're not using or engaging your core in the right way. It's probably because you face up a lot of flexibility issues, and that's where this compensation is taken up by your spine and your nervous system, or for that matter the nerves that come across these areas. So the idea is, whenever you do a core activation program, or whenever you visit a physiotherapist for this particular problem, first thing what ideally a physiotherapist would do is he will actually evaluate you, understand your flexibility, understand your core activations and how you have been doing it when it comes to posture, and start working on it, start working on your flexibility, start doing strengthening for your spine. And once these things are in place, there is a higher chance that your posture can get better. You start using your core muscles more compared to relying completely on your spine structure. This is one thing is very evident, that the changes that are already present on a X-ray or a MRI cannot be reversed. But what we are talking about is, how can we compensate the back muscles? How can we try to improve the muscles, strengthening of back muscles, through which this can be compensated and corrected to a great extent? Well, if that remains the case, because I'm not talking about miracles here, but yes, we have seen a lot of patients who have had these issues, and probably just 2 months of rehab has made a lot of differences, and it has somewhere either completely evaded the surgery part, or postponed the surgery for the next 2 or 5 years, because they have been able to improve more on their pain, improve on their core training, and improve on their posture. So this is what will happen in a small way. But yes, what is more important is that you should not be looking at results in a very short span. You should give it a time of at least 1 or 2 months for this core activation to happen. If you're looking that this results will happen in the next 1 week or 2 weeks, no, this is not going to happen, because we are not just activating your core, but we are also activating something where you already have a back issue, where you already are injured, where you already have inflammation, and we have to correct all these things. So there will be a lot of pros and cons in this. There may be days where you have pain, where your pain may increase. There may be days where you're feeling better. So you need to keep it consistent. Give it a shot for at least a month or two. Only then expect the kind of results, and then you can come to a decision whether you want to evade the surgery or no. I hope I have answered your question, Rakesh Yadav. Coming to the next question. Well, the next question is from Nupur, who's writing from Pune, and she wants to know, I have a 4-year-old kid and his walking doesn't seems to be right. My pediatrician has diagnosed this as vitamin D deficiency. Advice supplement and physiotherapy. Is it curable? Will my kid be able to walk normally? Thank you so much, Nupur, for writing in. And yes, your kid will be able to walk normally if you follow what I'm going to tell you from here on. Well, vitamin D deficiency is a very common feature among kids, especially above 3, and it goes up to 7 to 8 years of age. And typically what you would notice or see is that the walking doesn't seems to be fine, and they tend to develop something called bow legs or knock knees. Okay, so either they will be walking in this way, or their legs will be in this manner, and that's where they walk, and that's where the parents come to know that there is something wrong. And once they get it diagnosed, they come to know that this is vitamin D deficiency. So obviously your pediatrician has given you the supplements that are required for vitamin D deficiency, and probably also suggested you the food that should be taken in order to ensure that your vitamin D deficiency is taken care of. But what physiotherapy has a role to play here? So physiotherapy role is only about re-educating these muscles again, because as they start walking in a bow leg or a knock knee fashion, what exactly happens is that they don't tend to change this particular habit, and it's very important that these muscles are re-educated again and the walking pattern is restored in a normal way. And that's where a physiotherapy plays an important role. A lot of times parents tend to miss out on the physiotherapy, wondering that the vitamin D deficiency will take care of it and it will be absolutely fine. Yes, it can happen if it is a growing kid and if we can re-educate the muscles. But if the kid has been taking up that walking pattern, so it can become a little difficult. So it is highly advisable to follow up with physiotherapy and ensure that you carry on physiotherapy till you see that there is a normal gait that has been restored. So I hope I have answered your question, Nupur. Coming on to the next question is, we have a fitness enthusiast who wants to know, well, I have been working out for the past 3 years. Okay, and this is what his question is. His name is Avdesh. He's from Rajkot, and his workout has been working on a specific fitness regime for the last 3 years. Though I had results in the past, now it seems that I don't see much of a change. What should be exactly done? Thank you, Avdesh, for writing in. And from what I see is that I think you have not been changing your exercise pattern for a very long time, and probably this is something that you need to do. So what happens is that if you have been following a certain form of exercise every day, if you have been doing the same form of exercise or same form of sets throughout all days and for years together, yes, you will see results in the beginning. You will see a lot of changes that are happening in the body in the first second year, but after a certain span of time your body gets used to it. The body is almost used to this kind of exercise. You're using the same kind of muscles, only one group of muscles. You're not working on other group of muscles, because of which there are high chances of injury too. And because your body is not getting anything new in terms of learning exercises, in terms of engaging the muscles with different patterns, you will not see much of a result. So my suggestion is that you look to improve your frequency or increase the intensity of this workout. And also what you can do is change the pattern of your workout. Whatever exercise you have been doing, either you need to change, make it a little more difficult, or probably change the pattern by adding weights to it, or also work on your flexibility. Because if you are not flexible enough, I'm sure by this time, if you have been working only on one kind of group muscles, you will certainly have flexibility issues. So make sure that you start working on the flexibility issues and have a clarity about what exactly are you looking to do from the workout. Are you still looking to lose weight, or are you looking to bulk it up, or are you looking to have a lean body? Based on that, you can again format your workout in a proper way. And it's very, very important that you have more and more variety in your workouts, because more variety means more surprise to the body, and your body will respond in a better way. Doing only one kind of workout, your body will get used to it, and within 6 months or 8 months you will not see much of a results. So thank you so much, Rakesh Jadhav, for writing in. I hope I have answered your question. So friends, that was our 4 questions for this week. And once again, thank you so much for watching this show. You could certainly subscribe to our YouTube channel or all our other media channels wherever we are, on Facebook and Instagram as well. So you can follow us in all these social medias, and make sure you get to know about our next episode. We have these episodes which are done on a regular basis from on Thursdays. Okay, and you can certainly subscribe to our channel and be a part of this. Thank you so much. This is Dr. Sudarshan Singh signing off.